Is your patient struggling to catch their breath or feeling suddenly confused? These are the early, subtle warning signs of hypoxia, a critical lack of oxygen reaching the body's tissues. Recognizing these indicators quickly is essential to prevent rapid clinical deterioration. Keep an eye out for restlessness and an increased heart rate as the first red flags.
Inside the body, hypoxia occurs when there's an interruption in the oxygen transport system, often starting at the alveolar level. When red blood cells can't carry enough oxygen, cellular metabolism shifts from aerobic to anaerobic, leading to lactic acid buildup. This oxygen debt quickly stresses vital organs, specifically the brain and the heart.
To restore oxygenation, start by elevating the head of the bed to maximize lung expansion and ease respiratory effort. Administer supplemental oxygen as ordered and continuously monitor pulse oximetry to ensure levels return to the target range. Always reassess the patient's lung sounds and mental status to confirm the intervention is working.